Up first tonight, a Cronkite News special report on vaccination rates here in Arizona.
This comes at a time where the number of measles cases across the country is the highest on record since the disease was declared eliminated nationwide back in 2020. Analysis of data from state and local health departments reveals 681 cases of measles have been reported across 22 states this year, including here in Arizona. Previously, the highest number of reported cases in a single year was 667 back in 2014. The Centers for Disease Control and Prevention says most of these cases are appearing in areas that have low vaccination rates. In our state, health officials warn the coverage rate has dropped so low that an outbreak of measles and other vaccine-preventable diseases may rise.
Cronkite News analysis of data from the Arizona Department of Health Services shows these hot zones for low vaccinations among children in kindergarten. Maricopa County is the most populous county in the state, and its current vaccination rate is near 93%. Mojave County has the largest decrease in immunizations, dropping 3.7% in just the past year. The most at-risk county is Yavapai County with just an 83.3% vaccination rate. Cronkite News reporter Jennifer Alvarez traveled there to find out why this area in Arizona is heavily choosing to opt out of vaccinations and what the county's doing in response.
Health experts in Yavapai County say it all comes down to one thing: trust. They say many people in Yavapai County just don't trust vaccinations or the information and people behind them. Open roads, grassy fields, and natural landscapes are what many say make Yavapai County a peaceful place to live. It also has the highest vaccine exemption rates in Arizona.
Personal exemptions are used at a higher rate in our community,
which experts say leave community safety at risk.
If we were to, say, see measles spread in Arizona, Yavapai County is very susceptible and at risk for it spreading rapidly.
But why do people in this community choose to opt out of vaccines? Yavapai County experts say it's all about trust.
We have people who live in our county in kind of off the grid because they like being in a rural area where there's not a lot of government intervention. There's a segment of the population who feel that they want to live outside of government controls, and they see vaccination as a government mandate or control. Things injected into their bodies that they don't fully understand or know what's in there. And so I think that there's some varying vantage points of mistrust.
And health experts say this mistrust can have major consequences to what they call herd immunity.
We need to have 95% vaccination rates in the entire community. And if you do that, the people that can't get vaccinated because of a medical condition and babies less than 1 who can't get vaccinated for MMR yet are still protected because we have herd immunity. But what we've seen over the last 10 years is an erosion in those vaccination rates. And so when somebody comes from another part of the world with a disease like measles, there's plenty of other people to infect.
Yavapai County does not meet herd immunity rates, so the county is doing what they can to get there.
We do a lot of outreach efforts, and so we know that some people were never going to change their mindset on how they choose to immunize their children, but our nurses really work with each parent that we see.
A lot of doctors are, pretty stringent on the CDC recommendations and their schedules, but, at the county, there are people that just want to wait because they feel like too many vaccines for little babies is a lot, and so our nurses will work with them on a delayed schedule if they'd like.
But still, they recognize that legally, vaccinations in Arizona are a choice.
So we definitely advocate for them, but we also understand people's personal beliefs and, realize that we can't change everyone's mind or we can't convince them all.
And more parents, not just in Yavapai County, aren't convinced.
I don't trust the numbers, I don't trust what they're saying, it doesn't scare me.
Measles don't scare her either.
To me, that's nothing that I'm super worried about. My dad had them, my mom had them.
It's one of the most volatile medical, family, and community debates of 2019, whether parents should vaccinate their children.
Somebody isn't vaccinating, and that makes me angry.
I don't want 1 ounce of that injected to my children.
Why would you ever put your child at that risk? Why would you put someone else's child at risk?
If you believe that vaccine is so powerful and so strong, then why do you care if my kid is vaccinated or not?
Heather Wolcott's opposition to vaccines goes as far back as giving birth.
I did not want to have my babies in hospitals. I didn't want to go in there at all because I didn't want to vaccinate. I didn't want to be pressured into vaccinating.
And she believes vaccines risk more harm than good.
The chemicals in the vaccine alone scares me to death. To inject that into my healthy kids, to me it's like Russian roulette. Like, you just don't know what you're getting. And that to me is way more threatening than my kids getting the measles.
Other parents are strong supporters of vaccinations, like Jacqueline Phillips.
Yes, I love that there's this movement of making good choices for your children and, directing them to healthier options. Vaccination is a healthy option because the alternative is an illness that can either kill you or debilitate you for life.
She says people who choose not to vaccinate are putting others in harm's way.
I liken anti-vaccination to drunk driving, and this is going to really upset a lot of people, but if you think about it, it's a conscious decision that someone made that creates a level of harm to an unseen population. If you choose not to vaccinate and you become a carrier for that illness, you are a harm to everyone around you and you are an unseen harm.
She says parents need to not only think of their children, but of others as well.
Every parent is going to parent differently, and that's totally fine. But if your child is going to interact with other children, that's when you have to start taking that into consideration.
Still, Wolcott says parents should make the decision best for them.
Every decision you make as a parent matters. Before you put something into another human being that you're responsible for, you need to know what it is. If they're not going to read the ingredients in question and challenge what's being injected into their child, that is completely their choice.
Parents on both sides can agree on one thing, whether they vaccinate or not, that they're doing what they believe is best for their children. But health officials do say that choosing to not vaccinate can have bigger repercussions to herd immunity overall. Cronkite News reporter Veronica Graff explains.
This is how herd immunity works. When the majority of a community is immunized, it protects even those who cannot be vaccinated for medical reasons. The threshold for immunity varies because some diseases spread more easily than others. Health officials are concerned because vaccination rates have fallen below that threshold in some areas. This can leave communities at risk for outbreaks. Experts say measles is extremely contagious, so 95% of the population must be vaccinated for herd immunity to work.
There have been many bills proposed at the state legislature concerning vaccination.
Jennifer Alvarez is back with us now to explain how these bills sought to change current laws.
There are four main bills regarding vaccinations this session. House Bill 2470 aims to let students through 12th grade get a personal or religious exemption by having a signed letter for the school that says the parent received DHS info and understands the risks and benefits of their decision. This bill did not make it out of the House and appears to be dead for this session.
There was one parent who made a comment once when I had to turn in my exemption paper, and she was a friend of mine, and her daughter and my daughter were friends, and she just made some kind of comment like, well, when they get into public school, when she gets in public school, she'll have to be vaccinated. And I was just like,
HB 2162 aimed to remove the ability to opt out of vaccines for personal or religious reasons, though the medical exemption would still be an option for people who are medically unable to get vaccinated. This bill was not assigned to a committee.
My job really is to do what's best for all of Arizonans, and that includes keeping the children safe, especially in public schools where they're around many other children. So if a child doesn't have their vaccinations, they're really hurting what's called herd immunity. I honestly feel that we have more parents that are worried about, being gluten-free than actually getting their children vaccinated, which to me is a problem. You can't just go to your yoga instructor and them tell you, if you spread this ointment or whatever on your child, it's going to cure them. That's not reality. There's a reason why we have vaccinations.
HB 2471 is also known as the Informed Consent Bill. This would give parents more information on vaccines, including the risks and benefits of vaccines, the CDC ingredient list for a vaccine, the package insert, and information on how to report a vaccine injury. The bill never made it out of the House and also appears to be dead for the session.
If you go to any grocery store and you look at the package. So every single ingredient is listed in the package. And I thought, why not do that if we're not just what we're consuming, every day at lunch or dinner, but why don't we do that for what we're injecting into our children? So I think we should trust parents enough to say that maybe after they've looked at it, now they want to do their own homework, and that's fine.
And lastly, HB 2472 proposes to offer a blood test to check for immunity before you get a vaccine. Specifically, it's an antibody titer test, which would measure the strength of your body's immune response. This bill also didn't make it out of the House and appears to be dead for the session.
With all of your research, how are health officials feeling about this?
So health officials are extremely concerned about Arizona's safety if high exemptions continue and low vaccinations continue as well. They really see it as a big community threat.
And Jennifer, how about the parents? How do they feel?
So parents that don't support vaccinations really believe that it's their own choice to do this and really believe that they're making the best choice for their children and don't think that they should be pushed into doing something that they don't trust. For parents that do support vaccinations, they really think that parents that don't should think about the community at large and should stop just thinking about one child or one family, but to really think about the people who can't get vaccinated because of medical reasons or because they're too young.
Well, Jennifer Alvarez, thank you for your reporting.
Thank you.